Magandang gabi po sa ating lahat. Muli ay inaanyayahan po namin kayo to be with us in a conversation dito sa ISIP-ISAK on Faith and Society. Tonight, we have si Dr. Charlie Labarda. Si Dr. Charlie po ay doktor as well as merong PhD yan sa psychology. Naghahanap po tayo ng kasagutan dito sa pandemic besides lockdowns. Alam po ninyo, noong October 2020, meron pong nilabas na declaration 50,000 na mga doktor at mga scientists. Among them, Nobel Prize winners, who actually said that there is enough scientific literature that can be a basis for answering and responding to this pandemic, apart from lockdown. So ngayon po, we will try to also hear si Dr. Labarda kung ano yung mga possible na mga responses natin dito sa COVID. Apart from yung usual na lockdown, no? Na mukhang ito yung knee-jerk na impulse ng ating gobyerno.
Si Dr. Charlie po ay faculty sa Medicine Department, School of Health Sciences ng University of the Philippines, Manila. At sabi nga ni Doc Melb, siya ay may kaalaman sa medisina at also sa psychology. So nakakatuwang combination yan dahil yan na yan ang kailangan natin sa panahon ng COVID. Hindi ko na po patatagalin pa. Panoorin natin itong tape itong recording ni Dr. Charlie sa Alternative to COVID Response.
Magandang gabi sa lahat. Bilang isang doktor ay patuloy po nating pinag-uusapan ang hinaharap nating challenge, no? Public health challenge bilang isang bansa, bilang komunidad sa gitna ng pandemic na dulot ng COVID-19. So ngayong gabi, pag-usapan po natin yung ano pa ba ibang pwede natin magawa, no? Kasi magdadalawang taon na tayo sa ating pandemic at marami na siguro tayong mga leksyon at mga natutunan nitong nakaraang mga buwan at nakaraang taon kung ano ba yung mas magandang paraan upang masugpo natin ang epekto ng pandemya sa ating mga komunidad. So, gusto kong simulan ng ating pag-uusap tungkol po sa mga pag-aaral na ginawa ng iba't ibang mga scholars tungkol po sa epekto ng mass quarantine or lockdowns during epidemic. So, in general, no, sa kanilang pag-aaral, nakita nila na maraming hindi magandang nangyayari pag ang isang buong bayan o isang buong komunidad ay iyong sinasailalim sa isang malakihang lockdown o mass quarantine na kalimitan nakikita natin sa ating bansa at sa ibang bansa din na ganun yung approach nila sa pagkontrol ng mga epidemics tulad ng sa COVID-19. So unang-una ay nakikita dito yung mga mental health problems tulad ng mga psychological distress, no? Ang mga tao ay nahihirapan emotionally. Nagkakaroon din po ng heightened communication inequalities. Nagkakaroon din po ng problema sa food insecurity. At syempre, ito alam po natin to, no, sa Pilipinas, nagkakaroon tayo ng mga problema ekonomiya, no, dahil nawawalan ng trabaho at oportunidad na makapagtrabaho ang karamihan sa atin dahil sa lockdowns. Of course, isa din itong reality, no? Pag nagkaroon ng lockdowns, marami ding mga kababayan natin ang nahihirapang magkaroon ng access sa healthcare. At ito din, no? Alam din natin to, marami din ang epekto ng pandemya sa edukasyon, lalong-lalo sa ating mga kabataan. And tayo po ay isa sa mga natitirang mga bansa na hindi pa rin nagkakaroon ng face-to-face na pag-eskwela, no, sa mga kabataan. At marami ding kaso ng pagtaas ng violence, no, against women, no, gender-based violence dahil sa gitna, no, ng pandemya ay nagkakaroon ng stress sa loob ng tahanan at ito po ay nagdudulot ng mga away mag-asawa na pwedeng mauwi po sa pagsasakitan at violence, no, sa mga babae. Although generally may nakikita din mga positive effects, like for example, nagkakaroon ng voluntarism at pag-increase ng altruistic attitudes, no, maraming tao nagiging concern sa iba, pero in general mas marami talagang mga negative na epekto yung malawakang lockdown. So, base po sa pag-aaral na to, maalam po natin na tayo mismo nakakaranas ng mga ganong mga reality, no, sa ating mga komunidad sa gitna ng pandemya. So, ngayong gabi, gusto kong tingnan kung ano ba bang pwede nating magawa, no, bilang mga mamamayan, ano po yung pwede natin masuggest na sa ating mga pamalaan, sa ating mga leaders na gumagawa ng desisyon tungkol dito, at paano po ba natin mas mapapalawak ang ating response na hindi lamang po limitado doon sa lockdown o kaya quarantine na karamihan ginagawa ng ating kasalukuyang pamalaan. So, ngayong gabi, gusto ko pong umikot ang ating kwento, ang ating pag-uusap sa pamamagitan po ng pagkukwento ng iba't ibang mga storya ng mga tao talaga na nakakasalumuha ko araw-araw sa aking role bilang isang guro at bilang isang doktor, at paano po nila ini-express, no, ang kanilang mga karanasan tungkol sa pandemic. At gusto ko lang po i-plug in na isa po sa proyekto ng aming universidad ng UP Manila ay yung pagsusulat ng mga kwentong ito, no, ng pandemya. So mayroon po 3 volume ng libro na tinatawag po natin na the PGH, the Human Spirit Project, ay kung saan po marami pong mga may akda galing po sa universidad at mga estudyante, mga guro na nag-contribute dito upang ikwento yung mga nangyayari during this pandemic upang hindi po ito malimutan ng mga susunod na mga henerasyon. At hopefully, ang mga kwentong ito na nasa volume po, 3 volumes po, pagkalinga, paggunita at pagninilay ay magsisilbing guidepost, no, po sa atin in the future when we deal with pandemics also. So una-una, gusto kong ikwento po ang tungkol po sa kong kaibigan, si D, no? She's a devout Christian who lost his sister, no, to COVID-19 a few months ago. His family have experienced being quarantined and isolated as a result of the current pandemic. So despite his experiences, he continues to be a vaccine skeptic and refuses to have himself vaccinated. He's also active in social media and constantly share anti-vaccination posts and messages. So kami, kanyang mga Christian friends, we constantly remind him to verify the veracity and validity of his sources, which are often driven by conspiracy theories. So ito yung kwento ng kaibigan ko si D, no? My friend D. Now, one of the realities of the pandemic is that aside from the public health problem of the COVID-19 pandemic is also the social problem which we call the infodemic. So maliban sa pandemic, mayroon din nangyayaring infodemic. So sabi ng joint statement on managing the COVID-19 infodemic ng WHO, UN, UNICEF, at ibang multilateral institutions sa buong mundo, sabi nila, the coronavirus disease, COVID-19, is the first pandemic in history in which technology and social media are being used on a massive scale to keep people safe, informed, productive, and connected. At the same time, the technology we rely on to keep connected and informed is enabling and amplifying an infodemic that continues to undermine the global response and jeopardizes measures to control the pandemic. So ano ba yung infodemic? Yung pandemic po, ito po yung deliberate attempt, no, to disseminate wrong information to undermine the public health response and advance alternative agendas of groups or individuals. So sa tingin ko naman, yung kaibigan ko ay hindi naman po siya deliberate po talaga na nag-i-spread ng maling impormasyon, no, to undermine the public health response. But I think he falls into this category of people who are misinformed or who suffers from this disinformation campaign, no? And as a result, this can be harmful, no, to physical and mental health of people. Kasi nga, dahil po sa maraming impormasyon na nagkakalat po na unvalidated, unverified, at nagba-viral po sa social media at sa iba pang sources nating information, ito po ay nagli-lead to problems like stigmatization, nakakaproblema po yung ating mga public health measures. For example, at the start of the vaccination campaign, dahil sa maraming mga conspiracy theories about vaccination and all the negative social media posts about it, nagkaroon po ng vaccine hesitancy at medyo nahirapan po tayo makumbinsi, lalo na po yung mga senior citizen at kahit yung mga health workers natin na magkaroon ng talagang malakas na acceptance po sa vaccination program ng gobyerno. So this leads to very poor observance of public health measures, and this will reduce the capacity and the effectiveness of our institutions, no, our public health institutions to stop, no, the pandemic. So ito isa ito sa mga challenges na hinaharap po ng ating bansa. At ito po ang infodemic na to is not simply a problem of misinformation, because this meron talaga siyang consequences, meron siyang cost. Ano ba yung mga real life consequences ng mga misinformation, disinformation na nakukuha po ng karamihan ng mga kababayan natin mula sa social media? Unang-una po, misinformation cost lives. Mamaya pag-usapan po natin ano bang ibig sabihin ng unit cost life, because when false information or fake news spread like a virus, hindi lamang po yung virus yung pumapatay, kundi din po yung mga behavior ng tao that are rooted po, na nakabase po sa mga maling impormasyon na kanilang pinapaniwalaan, ay nagkakaroon po ito ng epekto sa buhay talaga ng tao. And also, isa pa rin masaklap na realidad po, pag nagkakaroon ng ganitong misinformation in the public sphere, it also polarizes public debate, especially in topics related to COVID-19. So, minsan hindi na nakakapag-usap ng matino yung mga tao, kundi nagdidebate na lang sila o kaya hindi na nagkakaroon ng conversation. Minsan nakakaroon ng hate speech at hindi pagkakaintindihan, leading to risks like conflict, in fact, like even open violence and human rights violation. And on the long term, kung hindi po ito matutugunan ng maayos ng ating lipunan, pwede po itong magkaroon ng epekto sa ating democratic space, no? Pwede din po magkaroon ng problema ng human rights and even our social fabric, no? Our unity as a community can be broken, no? Because of this kind of situation where there's a lot of misinformation, disinformation that is going. So it's important to address this issue, lalo na sa panahon ngayon where we have these technologies like the social media platforms that could lead to rapid rise of fake news. So, ang doon po sa statement ng WHO, UNICEF, UN, at saka iba pang mga multilateral institutions na global institutions po, it appears na parang sa kanila, it's simply an issue of accurate information. But I would like to suggest, kasi nga based nga doon sa ating previous na discussion last May, no, nung ako po ay naging guest po dito sa ating episode po, isang episode po, yung first part po ng COVID in the communities, na pinakita ko doon bakit nagkakaroon ng vaccine hesitancy ng mga tao. And at the heart of the issue is the issue of trust. Kung mayroon bang trust between the citizens, no, yung mga mamamayan at saka yung mga public institutions that are purported to be there to serve the people. So I would assert na beyond the accuracy of information, which is a problem with infodemic. I think the infodemic is rooted in an issue of trust. Just very quickly, I would like to cite not two models that have been, sort of floated out there in terms of a national response, no, to the pandemic na pwede nating tingnan, no, para lang model to evaluate also our own country's performance, no, in terms of managing the COVID-19 pandemic. Unang-una is isang model na talagang many people in the past few months have really put out there and praised it, is the model po ng Australia at saka New Zealand. So Australia New Zealand model is a model where pinakita nila, no, na pwede palang magkaroon ng appropriate response to the pandemic even if you choose to open up earlier, no? Pero the key there is that they have very early response also. So at the very start, they started with aggressive border control and intense contact tracing, and then after they were able to establish those protocols in place and put those borders in place, then they open up their economy without much restriction. Pero in a way, parang in-isolate nila ang sarili nila for a time, no, from the rest of the world. So yun po yung ginawa ng New Zealand. And these are basically democratic institutions, countries, no, that respected human rights, etc., have high values, no, in terms of democratic space and conversation. But for the first few months, they were really the countries that have been able to use their own democratic institutions, the strength of their public institutions, to deal with the pandemic in an effective manner. And for several months talaga, na-control nila po yung pandemic. Another model that is on the other side of the spectrum is that of China. So China was able to successfully control the pandemic in its own borders, no, for a time. And how they did, paano nila ito ginawa, no? They have a very strong centralized state, no, that was used to exert control over their population. So they use a massive population-based lockdowns na talagang regulate nila yung movement ng millions of Chinese citizens, no, and they really penalize, no, especially officials who failed, no, to live up to the expectations of controlling the epidemic. Both were successful. Both models were able to, for a time, bring down the cases, but they used totally different approaches. The implication of that is, as I've mentioned earlier, I think for both countries, no, one democratic country and one hindi ganon yung kanilang political space. I think both state government institutions were able to work and generate trust among their population. So yun po, no, yun po yung konteksto ng pandemic, no, and how it is important to generate trust among the population so that we'll be able to effectively deal, no, with the consequences of the pandemic. So another story that I would like to share to you this evening is ito po yung storya ng isang ale po na na-meet ko during the time when I was volunteering, no, in a pandemic site. And the triage nurse approached me because the Ate F, no, the scholar Ate F, had coughed for the past 5 days. She had no other symptoms like fever, headaches, body malaise, or loss of taste and smell. However, she was hesitant to be vaccinated because of her cough. She finally decided to defer her schedule for vaccination. So itong kwento na ito, very common, no? Doc, pwede ba ako magpabakuna kahit ako po ay may ubo? Meron akong nararamdaman ng hindi maganda sa katawan. Should I be vaccinated? So this is an issue about how do you know na mayroon po kayong COVID o kasi di ba pag may COVID ka, hindi ka pwede magpabakuna o kapag may COVID ka, hindi ka pwedeng lumabas o hindi ka pwedeng magtrabaho. So, many people are not really aware, no? How do public health workers like doctors or nurses decide where the patient is highly suspected for COVID and when to decide na okay ka lang, you are safe. So the recommendations right now is that usually when we screen for COVID, we look for flu-like symptoms. No, so what we do is that we look at the past 2 weeks. So past 2 weeks and look for symptoms like fever, cough, sore throat, no, runny nose, myalgia. Ito yung mga sakit sa kasukasuan, headache, fatigue, body malaise, parang pagod ka palagi, o diarrhea, nagtatae, nausea, vomiting, nagsusuka, anosmia, nawala ng hindi mo na makaamoy na maayos, ageusia, hindi ka na lusag taste, shortness of breath, and dyspnea. So these are the things that usually health workers will look for if you have symptoms. So should be aware, no, of how generally we look at the healthy adults who have sometimes upper respiratory tract infection, and how then do you evaluate whether or not they can be suspected of COVID-19. So mamaya I'll show you a classification system for diagnosing based on clinical symptoms. But these are the things that are being looked for, no? That are being screened for by your public health workers. No, isa rin palaging tinatanong sa akin is, pwede ba tayong gumamit ng rapid antigen test to diagnose COVID? Kasi ito, pwede ka makabili. These are much cheaper than the RT-PCR test. The answer is yes, you can use it, but you can only use it in people who are symptomatic. So symptomatic, ibig sabihin yung nagsususpetsa ka na dahil may siyang ubo, may lagnat, mayroong sipon, mayroong headache, mayroong fatigue, mayroong diarrhea, etc., etc., nahihirapang huminga. And then yung mga symptoms na po niya ay less than 1 week po. So when you do the test, the symptoms should be less than 1 week. And hindi po lahat ng rapid antigen test are equal. Meaning to say, mayroong mga rapid antigen test that are better. For example, you should look for brands that have sensitivity of greater than 80%, then specificity of greater than 97%, so that you'll be able to have accurate information with regards to diagnosing whether or not you have COVID. Okay, so yun. No? So mamaya we'll go back to that later. Another story that keeps repeating itself in my own personal experiences, no, with COVID is about ivermectin. So, for example, just recently, a family friend was asking in Messenger if he could ask for prescription for ivermectin. He was afraid that he might get infected kasi meron po siyang kasama sa bahay, yung kapatid niya, who had COVID-19 and nandun sa bahay and wanted to have prophylaxis. So he got some information that ivermectin can be used for this purpose. So we had a long discussion of this on the use and the risk of using the drug for COVID and what are the evidence for and against the use of ivermectin for COVID-19. So what we have today in terms of ivermectin, the best evidence out there is that it is not as yet recommended, no, as a COVID-19 prophylaxis for the general population. Hindi rin po siya na-advise na gamitin mo din siya as a post-exposure prophylaxis. Ibig sabihin, kung mayroon ka talagang kasama sa bahay na nagkaroon ng COVID, hindi rin po siya ina-recommend na gamitin mo as a post-exposure prophylaxis dahil na-expose ka sa kaibigan mo, sa sa kasama mo sa bahay na mayroong COVID at take ka ng ivermectin. At hindi rin po siya na-recommend even for healthcare workers who are constantly exposed to possible COVID-19 patients as a prophylaxis. So, bakit hindi? Kasi po, karamihan po ng mga studies on ivermectin, tinatawag po natin na meron pong risk bias. So, hindi po well-designed yung mga studies na ginawa po with regards to ivermectin. And therefore, hindi po ganun ka-strong yung evidence. And as a result, what we have right now, the information that we have right now can be misinterpreted or abused or misused. In fact po, yung tinatawag natin na human-grade ivermectin, wala pa pong emergency use authorization from the FDA. Nag-a-apply pa lang po sila. Ang mayroon po tayo ay animal-grade ivermectin na hindi naman po tayo mga hayop para gamitin po yung mga ganon. And in fact, many experts are afraid that even just giving ivermectin the green light as a prophylaxis might even derail the national vaccination program of the government. Okay, let's now go to another story that I would like to share. One heartbreaking story I would like to share happened during the month of June this year. June was a very difficult month for us sa church po namin. We lost about 4 members of the church to COVID-19 during that month in a span of 4 weeks. So our friend Ate N was one of the most lively participants of our online prayer meetings and Bible studies. And she came down with symptoms of fever, cough, and body malaise. Her husband became symptomatic also, and since he had a lot of comorbidities, he was admitted to the hospital, while Ate Ann opted for home care because there were no available beds po sa mga hospitals po sa aming city at that time, because there was like a surge of cases. However, her oxygen saturation slowly went down, and she was hooked to a high-flow oxygen setup at home. She was finally admitted after a few days with oxygen saturation in the 80s. By then, it was too late for her. So, karamihan po kasi ng mga pasyente po nagkaka-COVID, ang problema po nila talaga yung paghinga. So, kaya po binabantayan po natin yung mga simptomas, lalo-lalo na po yung oxygen saturation po. Ito po yung ano po yung level ng oxygen po sa ating dugo. Kasi po yung isa sa mga sensitive indicators whether or not you will have respiratory problems po as part of your COVID-19 symptoms. So let me just start by reviewing ano ba yung ibig sabihin natin ng severity po ng COVID cases. So meron tayong mga tinatawag na mild COVID, meron tayong moderate, may tinatawag tayong severe COVID, at finally yung pinakamataas, ang pinakagrabe, tinatawag na critical COVID. Yung mild COVID, na karamihan naman po ng mga nagkakaroon ng COVID ay nagpo-fall po sa kategoryang ito, ay yung mga pasyente po na o yung mga tao po na nagkakaroon ng COVID pero wala po silang pneumonia, wala pong problema sa oxygen po sa kanilang dugo. Wala din po silang lagnat, wala din po silang ubo, pero mayroon silang pong simptomas na tatlong simptomas po itong mga flu-like symptoms po na tulad ng headache, diarrhea, nausea and vomiting, loss of sense of smell or taste, yung mga nawala na panlasa, body malaise. So, pwede po yun. Or pwede pong mayroon kang cough and fever. Yung po, pwede kang magkaroon ng ganun lang pong na presentation. However, pag magkakaroon ka ng situation like elderly ka o mayroon kang comorbidities like diabetic o kaya hypertensive, automatically po, pag mayroon kang mild symptoms of mild COVID, plus mayroong comorbidities o elderly ka, automatically po, ikaw ay na-consider na moderate COVID po dahil because of your comorbidities. Yung moderate COVID po naman po are those people with pneumonia. However, wala din po silang problema in terms of difficulty of breathing. May pneumonia lang sila, pero hindi pa problematic yung paghinga. Yung kanilang respiratory rate, na how many times they breathe in per minute, ay less than 30. And if you look at the auto-saturation, yung mga pulse oximeter na ginagamit natin sa bahay to monitor autosat, greater than 94%, equal to 94 or greater than 94% autosat. So moderate po. Naging severe na po yung classification ng COVID pag may presence na po ng pneumonia, plus nahirapan ng huminga, plus yung autosat as measured by the pulse oximeter is less than 94% saturation. Then mas mabilis na yung paghinga mo, greater than 30 breaths per minute, at you find yourself needing oxygen supplementation. So that's a definition already of severe pneumonia. And my friend po si Anne falls under this classification. Unfortunately for her, she stayed manage her case at home po dahil wala pong beds na available sa kanya at that time. At prioritize niya po yung asawa niya kasi may mga comorbidities yung asawa niya. Kaya she just managed herself at home. Yung critical naman po na COVID ay pong mayroon pneumonia tapos talagang hirap na hirap ng huminga to the point na hindi na niya kayang huminga kung walang high flow oxygen at kailangan na ng ventilation support. And you have acute respiratory distress or nagmanifest na shock or nagkakaroon na po ng changes in sensorium, yung consciousness, parang wala na sa kanyang right sensorium o naglulus na ng consciousness at nagkakaroon na ng multi-organ failure. So ito na po yung end stage na COVID and we don't want patients going into this critical stage. And it helps to know na what are the different stages of your COVID symptoms. So, with regards to management, ano ba dapat yung ibibigay sa mga pasyente o mga tao na mayroong COVID-19? So, for a long time, wala masyadong established protocol. But eventually, at the past few months, through the studies that have been conducted, we have been following recommendations po. Itong mga tinatawag natin na management po ng respiratory care ng ating mga COVID-19 patient. For example, it is recommended to use steroids, yung dexamethasone are steroids that are recommended especially for those who are already needing oxygen supplementation. So binibigyan na po ng steroids sa mga pasyente na kailangan ng oxygen. Tapos pag na-hospitalize po kayo with COVID, usually binibigyan na po ng prophylactic anticoagulation kasi naintindihan na po natin na isa sa mga problema po ng COVID patients po ay yung coagulation cascade that are activated during these stages of the disease. Nire-recommend din po yung use ng high flow nasal cannula rather than the use of face mask kasi mas effective po yung flow po ng oxygen sa pasyente. And of course, the use of your extracorporeal membrane oxygenation for selected COVID-19 patients who have severe acute respiratory distress syndrome based on the criteria set po by ALSO.
Nagkalat na ang fake news sa social media. Let us fight fake news with the good news of our faith in Christ. Join our social media network and be an advocate of truth for the Philippines and for God's kingdom. We are looking for volunteers in the areas of content creation, research, graphic design, and video editing. To join, send a message to aprilfaliaria.isacc@gmail.com.
Okay, so at least marami na tayong ganong standards of care na na-develop po with regards to the management of COVID-19. Now, marami ding experiences na nangyayari sa akin na they ask me like, pwede bang uminom ng, for example, sa amin, mahilig kami uminom ng tuba, no? O coconut wine. Kasi narinig nila na effective daw po yun as a treatment for COVID. So in fact, it was a professor friend of mine, a colleague, no? Who half-jokingly remarked that it's better to drink tuba nowadays because of the protective effect of coconut against COVID-19. In fact, there are really ongoing clinical trials involving the use of virgin coconut oil as an adjunctive treatment for patients with COVID-19. So what's the evidence for this? No? Ang mga adjunctive treatment na to. So based on the best available evidence, here are the following recommendations of the experts, no, based on the best available evidence today. Una-muna, wala pa pong ebidensya to support the use of virgin coconut oil as a treatment, no, adjunct treatment for COVID, pati din yung zinc, pati din vitamin C, vitamin D, vitamin B, yung N-acetylcysteine na nakikita natin sa mga cough medications o yung mga oral fatty acid supplements. So hindi po siya proven, although there's still ongoing clinical trials, but at this time, hindi po siya routinely recommended for the use of COVID-19 patients. Hindi rin po inirecommend yung paggamit ng mga melatonin, vitamin D, zinc, hydroxychloroquine, yung mga saline nasal irrigation, yung mga steam inhalation, tsaka mga antiseptic mouthwash for the prevention of COVID-19 disease. So wala po siyang ebidensya na useful siya to prevent COVID-19. Another thing na nangyayari po in the communities also is that people always tend to ask me as a professional, no, which vaccine brand is best. So because I usually volunteer in one of the municipalities here during their vaccination drives, one mother who was vaccinated with her second dose of AstraZeneca joked to me, and she said, "Oh, I could finally travel to the US kasi nga AstraZeneca rather than Sinovac, no? For instance, is recognized in the US." Pero sabi ko naman sa kanya, bakit may visa ka ba? You have to get a visa first, no? So, tumawa siya. That's true, Doc. Pero sabi naman niya, but I feel safer now. So, what is our stand? No, what is the best evidence with regards to vaccine brands? No, in terms of being the best for COVID-19. So the recommendation is that all of the vaccine brands are actually recommended, no, for the prevention of symptomatic SARS-CoV-2 infection in adults, or COVID-19 infection. So this includes your Pfizer, your Moderna, your AstraZeneca, your Gamaleya. The Russian brand even is also recommended. The Johnson & Johnson, single-dose shot, and of course, the CoronaVac or Sinovac. So, of course, may pagkakaiba yung levels of recommendation, but generally, although we have certain bias for Pfizer, Moderna, and for example, Johnson & Johnson, the rest, no, of the other vaccines actually are being recommended by experts because they have been shown to prevent symptomatic SARS-CoV-2. So still, the best answer during this time when there is not much enough supply of vaccine, which vaccine is the best vaccine? The best vaccine is the available one. No? Best vaccine is available. So get vaccinated as soon as possible at wag nang manili. So, as we go draw close to our sharing, no? So let me tell a story about a friend of mine, no? Who really loves talking about the end time. So a good Christian friend whom I admire for zealous faith and commitment is well versed on a particular interpretation of the end times, where Christians will be spared from a period of intense suffering and persecutions. And I noticed that many of my friends who are also convinced of the same kind of interpretation also happens to be highly skeptical of COVID-19 in general and of vaccinations in particular. So I was asking myself, is this just an accident or there's something deeper that is going on here? Because in fact, we have a lot of lively debates about this issue. But I suspect that our differences is rooted in our different understanding of creation theology. So it starts from understanding of Genesis. So I think many of the differences of Christians today, with regards to the issue of vaccination is actually rooted in our theology and our understanding of our calling, as stewards of God's creation. So for me, I suspect that a theology that can frame pain and suffering, yung paghihirap, yung karanasan ng mga tao during this pandemic, is part of the process of birthing the new heavens and the new earth, is better equipped to deal with the hard realities of the pandemic. I suspect that many of those who are who are hesitant, with regards to the vaccination, or suspicious of COVID, and are easily swayed by conspiracy theories. Mayroon silang certain theological predisposition that makes them prone to be easily convinced, of the vaccine skeptics. And I think this is more something. It's not really. I think this has something more to do with theology rather than psychology. I would like to say that. Kasi lahat naman tayo, we experience the same situation, we go through the same experiences of the pandemic, but even we Christians, we have different responses. We have different responses to what's happening around us. And I think this is, at the root of it is a different understanding of our role as co-creators of God's garden. So where do we go from here? So I was being asked, ano ba yung alternatives to lockdowns? We're nearly 2 years down the road, and we could know, we have suffered a lot in the past year. Can we go beyond lockdowns? Or what is the better approach than lockdowns? And I think marami na po nagsasabi that lockdowns can only work for a time, but it will not work for a long time. It will not work if it's the only policy that will be implemented to control the pandemic. And based on the discussions among public health experts, I think the number one priority that we should be able to do in response to the pandemic is to vaccinate as many of our people in the shortest possible time. So vaccinate. So we have to reach herd immunity. Kasi without herd immunity, we will not be able to reopen. And one thing that I would like us to say is that we need to put our children back to school as soon as possible, because the long-term consequences of prolonged absence from school, prolonged deprivation of face-to-face interaction of school-age children will be much more severe than the consequences of reopening our schools. There's already a lot of mental health problems that have been noted among our young children, and there's been an increase in public health problems like teenage suicide, teenage pregnancy, child substance abuse, and this will the cost of lockdowns will continue to rise as we use it for a longer period of time. So we need to begin vaccinating our school-age children, I think, and include them as part of the priority population so that they can go back to school soon. And we need to, test aggressively and treat cases aggressively and isolate them from the rest of the population. In fact, there are many opinion writers, many in the university, for example, have been advocating for the use of rapid antigen test with high sensitivity and specificity to screen. Do not wait for the RT-PCR test kasi minsan ang hirap talagang magpa RT-PCR, ang haba ng pila, ang tagal ng resulta, and this delay in terms of the diagnosing your status as a COVID-19 suspect, confirming or disconfirming it as a toll also in terms of of the exposure, the risk of exposure, and of course, limiting your movements and your capacity to live your life normally. And of course, I think we need to generate trust, no, by using the best scientific guidance rather than constantly changing policies based on political whim or convenience. Now, this was brought to me a few weeks ago by the fact that kahit yung contact tracing na hindi natin maayos ng mabuti. No, we have a lot of technology that have been developed. We have developed these apps for several months already. Yung mga safe city apps, yung safe Philippine app, yung kayang nasa mobile app lang. And they already have contact tracing. They have contact tracing modules. They have tawag dito different capacity, no, to make sure that we know where people are and who are in touch with whom. But because there is no uniform standards for implementing our policies, and the policies that we're implementing keep changing by the day, and most of the policymakers out there are not really the experts in the field. They're politicians or been appointed by politicians. There is a lack of cohesiveness and basically a lack of trust, no, to the pronouncements of our leaders, and this is problematic for our country. So I think we need to work on this and make sure that the best people who have the best evidence will be the ones that will be able to provide policy inputs that will be implemented by the government. And of course, we need to leverage available technology, to be able to respond appropriately to the pandemic. So we need to use digital technology. We have to use the available information communications technology. We have to use social media, leverage social media for these purposes, because we need all the tools, that we have right now to be able to effectively manage the crisis that we're facing as a nation because of the pandemic. So these are stories on the ground that we have. There are more stories that we actually live through each day because of the pandemic. But one thing that we know for sure is that the best way to approach this pandemic is by listening to each other and working together as a community and giving the best, giving the best to our country, by looking at what works and what does not work, and make sure that our policymakers will listen to the best available evidence that's out there. Maraming salamat at magandang gabi sa inyong lahat.
There are three main things siguro na we need to have as a keepsake doon sa kanyang mga sinabi. Yung first thing is yung tinanong niya na question, is this an issue of accurate information or of trust? Kasi sinabi na nga doon sa joint statement ng UN and other development institutions, worldwide, na there is a great deal of information, scientific information out there because of technology. But also there is a great deal of infodemic, At bakit po? Ito ba ay issue ng you get flooded with all this technical information, or issue na there is distrust? Kaya maraming mga propaganda, sa messenger ko lang, mula sa mga Kristiyano, ng mga friends ko sa iba-ibang bansa, maraming, I get flooded with all of these mga issue ng conspiracy, yung efficacy ng mga vaccines, si Bill Gates, at saka yung kanyang mga cohort daw ng mga scientific would like to rule the world, etc. Pangalawa dyan, siguro yung issue rin ng ng ano yung best scientific evidence, yung sa ivermectin or kung ano-ano pa, at ang advice ni Dr. Charlie sa atin is to try to see the best scientific guidance. Sa totoo lang po, we have to trust yung ating mga scientists, no? At first instance, unless they are proven to be talagang niloloko lang tayo. Kasi, karamihan naman ng mga medical health practitioners are really there because they want to make yung creation better, no? Apart siya ng yung scientific enterprise is part of our cultural mandate yan, no? What it means to discover and fill the earth, and subdue it so that yung population can flourish. Yan ang tinatawag na cultural mandate. And I think we need to see that yung mga the best of scientific discovery should be respected. Ngayon, this time it clashes, no, with a very specific worldview about end times. Kaya binring up ni sa atin yung issue ng creation theology, no? O baka ito ay mass psychology ng mga Kristiyano. Na merong ganitong end times. Now, malaking usapin ito, but I think we can summarize yung conflicting na worldviews nito into two things. Number one, we can look at what is happening now as signs of a sinking ship, no? In other words, ito yung stream ng end times na theology that says maguguna na yung mundo, so wag na nating masyadong palawigin yung ating suffering. We just jump ship, no? Ganong tipo. The world is a sinking ship. At ganyan talaga ang mangyayari. Magugura ang mundo. And the other is yung sinabi ni sa atin, ni Doc Charlie. Can we look at this simply as birth pangs? The fact that yung ating lives, ang ating work, ating ministry have been scrambled. No? And not just Christian communities, but everybody. But can we look at this not as the end of the world, no? But as birth pangs for a new world. So dalawa pong competing yon na actually theological din. Are we thinking of the world primarily as a sinking ship or a world that is being renewed, being recreated, a fallen world that is being redeemed? That's why, sabi, even nature is looking forward to the redeeming of the sons of men. Unang-una na tayo and as well as the whole of creation. So, tingnan natin yung, ano ba to? Sinking ship na nga ba to? Maguguna? Or is this world going to endure? But this time, transform, no? Into a new creation. Kung akong tatanungin ninyo, yun po yung mas malaking big picture eh. Dahil mula sa Genesis, no? Hanggang sa Revelation, sinasabi, anong sabi ni Jesus? No? Behold, I make all things new. We may have fallen noong Genesis 3. But ang promise is that there is this redeeming of the world through the seed of the woman. And since then, merong ganitong conflict, no? The seed of the woman and the seed of the serpent. So, merong ganong conflict sa human society. There always this conflict between good and evil. At hindi lang ngayon yon. Noong pa po. At sa susunod pa. And what will make the difference is whether the people of God are prepared to show up. Ano yung mga things that we have seen as normal simply because they have been routinized. Siyempre, kahit naman pangit na mga habits, when they have been routinized, akala mo yun na yung normal. Injustice, we think it's normal. All the corruption in the bureaucracy, we think it's normal. Kaya ganyan talagang kalakaran. No. The only way it looks normal is because we have lived with it for so long in complacency. Hindi po normal yan. At ngayon, parang front and center, pinapakita ng Diyos kung ano ang mali sa ating sistema, anong mali sa mundo, at ano ang dapat gawin so that we show up as His church. At magkaroon ng true normal, hindi yung old normal, no? Na ni-resurrect lang natin, the true normal. That should be routinized, that should be once again systematized into new habits, new structures, new systems. Ito po yung birthing of a new world. At ito ang invitation sa atin. Let us show up, mga kapatid. So yun lang po, and the Lord bless you. Pagpalain po tayo lahat.